The National Expert Group on Vaccine Administration is likely to decide on how long one should wait to get vaccination after recovering from coronavirus. It is learned that the expert panel has recommended a wait of 9 months for inoculation of those recovering from COVID-19. However, sources in the ICMR have said that considering India's case burden, the wait for 3 months has to be adequate. Studies have shown that India recorded a reinfection rate of 4.5% during the first COVID wave and identified a gap of 102 days in between. Some studies from other countries have also indicated that one might have immunity for about 6 months following natural infection with SARS-CoV-2. Sources say that this data may have been used in building the basis for expert panel's recommendation on vaccine gap for people who have recovered from COVID. Joining me now live to discuss this are Dr. Vishakha Shivdasani, physician and author of COVID and post-COVID recovery, Dr. Sheetal Sabharwal of Jeevan Hospital, Dr. Sameer Gupta, Director of Cardiology of Metro Hospitals, and very soon we are also going to be joined by Dr. Atul Mashru, who's a physician from Mumbai. I want to start this broadcast with Dr. Vishakha Shivdasani. To you first, Doctor, this particular recommendation has just come in, but the immune system does retain, as we know, the memory of the virus. How long does it last after the infection still remains to be unclear, and you can correct me on that? This particular advisory says wait for 9 months. Isn't that too long?
Chaiti, we don't know for sure. This virus is teaching us on the go, right? What we do know is that in patients we have seen who have COVID infection, who have had the vaccination, we have measured the antibodies, the neutralizing antibodies, and we do know that they stay in your system for more or less about 6 months. So 3 to 6 months is a fair window. 9 months, we're not sure as yet, and maybe it would stay in a few patients, but maybe it might be, for a fair number of patients, it might be pushing it too far. That would be my personal opinion.
So
I would say between 3 and 6 months.
3 and 6 months is what you recommend. Dr. Sameer Gupta, we've had multiple discussions on this, that the earlier you get it done, the better it is. But in your view, what is the minimum that one needs to wait before getting that jab after recovering from coronavirus?
You know, Chaiti, that's a great point. There have been some studies, let me say that every day we learn something new about the virus, we learn something new about the vaccine, and we learn something new about the immune system and immunity. There have been studies which have been conducted, some of them out of Copenhagen and Denmark, and some out of the US, which have shown that 95% of people who recovered from COVID-19 had durable memories of the virus for up to 8 months of infection. And I think that is what the expert panel has looked into and recommended 9 months. Now, that being said, we are seeing this immunity varies from person to person, but we don't have a very high reinfection rate as of now. The infection rate is much lower, and it is more in people who are above 65 years of age. And they are potentially people whom we have already covered in the first phase of vaccinations. So I think the data is coming out. 6 to 9 months, 9 months might be a stretch. 6 months might be something which may be a little bit more durable and a little bit more palatable as of now. But I think the data waits to be seen.
9 months is a bit of a stretch, is the common consensus I'm picking up. Dr. Sabharwal, your first up reaction on whether 9 months is a bit of a stretch or not. The US Center for Disease Control and Prevention, Dr. Sabharwal, has suggested a wait for 90 days from the day one tests positive for COVID if he or she has not received the vaccine. Do you see this decision now coming on the back of a shortage of vaccines? Because if you remember, the same committee asked for increasing the gap between doses for people across the board too.
Yeah. You know, I also personally feel that COVID-19 is something we hear new information every day. There are new studies that keep coming in. As we learn about COVID-19, it is teaching us many lessons also. I personally feel that the window of 3 months for the gap of vaccination is a more practical window, because if we see the antibody profile of patients, the antibodies after getting a COVID vaccination peak at 3 months and then start declining up to a period of 6 months. So 3 to 6 months is a more practical window rather than 9 months is a bit of a stretch, I personally feel. And as we see in our medical fraternity, we all are seeing these days how many doctors who've already been vaccinated with 2 doses are getting infected with the vaccination within a period of 3 months. of getting the vaccination. And I personally am one of them, have got the infection 2 months after my dose. So I feel a gap of 3 months after, as was also recommended by the ICMR, a gap of 3 months after the second shot is a good window. If you stretch it up to 6 months, that's fine. But 9 months is a bit of a stretch, I think.
So 9 months, a bit of a stretch, is a common consensus. Dr. Sameer Gupta, there have been so many reinfections that have been witnessed post-recovery, and you in your practice have witnessed so many of them. In fact, earlier I was reading one of the articles where Dr. Guleria had said that 4 to 6 weeks is something that one can wait. And isn't that something that most docs are recommending in terms of not waiting for too long, in terms of 9 months to get that jab? Because if you see, India has been on fire as far as reinfections are also concerned.
Yeah, so now there are two parts of the question, right? One is infection after the vaccine. If you've not had the COVID infection, that's one part. And the second part is reinfection after you've got COVID. So you've got COVID once, and then 6 months later, you're risk of COVID. After the vaccine, I wouldn't call it reinfection. I would still call it primary infection. And what we are seeing after the vaccine, I know, some doctors, in spite of both vaccines, have died, unfortunately. But that still remains really low. That number still remains really low. And we are seeing people who would otherwise, in the natural course of illness, should have a moderate to severe infection, but because of the vaccine are probably getting mild to moderate infection. So there is definitely some benefit of the vaccine. Now, when you're talking about reinfection, from COVID, there have been case reports, but it's not that many of people who are getting reinfection after getting the infection the first time. So you've had one COVID, now can you get the second COVID? That number is very, very small as of now, probably because there is some immunity from the antibodies that were generated from the first part. And like I said, there have been some studies which have shown that immunity can last up to 8 to 9 months. 9 months, once again, maybe a stretch because that's when it starts declining. So 6 months may be a more, maybe a better window of sorts.
Dr. Vishaka, in your opinion, how long do antibodies last? So say I've gotten infected, how long typically would my antibodies last that would give me protection, after which probably I do need the jab?
So, the window tends to be quite large. Like my colleagues have been saying, it can be from up to maybe from a month to 6 months. So it's a large window. So different people have, we can't keep testing them for the neutralizing antibodies. So there has to be some sort of consensus midway. Also, we need to understand we can't focus only on the antibodies. We do have some amount of T memory cells which also play a role. So even if you do have dwindling antibodies, these memory cells do have a role in prevention of, not really prevention, but in prevention of bad infections going forward, even if you are, reinfected. So they do protect you from getting a severe infection, from reaching hospital, from needing oxygenation. So that we have to make sure that we don't nullify that aspect and talk only about the antibodies.
Understood. And Dr. Sameer, what if the infection was asymptomatic? Then how long does one need to wait before getting a jab? Does that also last for, say, top 6 months?
So, that's a great question. That what is the immune response? So your question basically is, what is the immune response generated by the body in case somebody has a mild infection or an asymptomatic infection? Now, when you look at antibodies that are created, Chaiti, there are two types, right? One is the antibodies, and the second is the memory of the cells of the immune system. That the next time the virus comes in, do the memory cells have the adequate infrastructure and memory to mount an antibody response? If it was not the case, then we would be seeing a much higher reinfection rate. Once again, the reinfection rate that we are seeing in the community is very small. It's probably in single digits. And people who are more than 65 years of age have a higher risk of reinfection. So that's the vulnerable group. So in that, the window of the vaccination maybe can be brought down to 3 months or maybe even 6 months in that population.
So even going by that, 9 months still looks like a bit of a stretch. Dr. Sabharwal, studies are showing that India recorded reinfection rate of 4.5% during the first COVID wave and identified a gap of 102 days in between. Now, some studies from other countries have also indicated that one might have immunity for about 6 months following natural infection after COVID. Now, do you see that this is perhaps the data that has been used in building the basis of the experts panel recommendation on the vaccine gap of 9 months?
I just feel that more than the rate of reinfection, the data has been built on antibody studies across population. And as far as the reinfection rate, as mentioned by Dr. earlier, is not very high. Whereas after a bout of COVID infection, antibody levels were monitored in various studies, and that has mainly been taken as the basis for deciding the dose when the second dose should be given. And you will be surprised that initially there was a consensus that for asymptomatic patients, the vaccination, the second dose can be given as early as 2 weeks after the last symptom. We are now looking at 3 months, and it is really, really very dynamic as to how things are changing with COVID. We were talking about waiting for 3 months only for patients who got plasma therapy. But now we hear a wait of 3 to 6 months is good for anybody who got COVID, and mainly the decision is based on the antibody levels.
That's right. Dr. Sabharwal, hold on right there. The National Expert Group on Vaccine Administration is still going to be deciding on the 9-month time period, and all of you somewhere are in agreement about the fact that 9 months seems to be a bit of a stretch. So if I had to pose that question back to you, Dr. Vishakha, and ask you for your recommendations, in a very conclusive way as to what should be the period of wait after my recovery, what would your answer be, and what would be your reasons for giving us that answer?
To be different for different groups of patients. I think that window can change for younger people and can be longer, can be 6 months for somebody who's say 45 and under, somebody who's more vulnerable with multiple comorbidities over the age of 60, 65, maybe that number needs to change to 3 months. So I don't think you can have a fixed rubber stamp prescription in terms of, even number of months for the vaccination. But I think that kind of needs to be tailor-made and said, okay, maybe under 45 or people with comorbidities over 45, over 60, that number needs to be smaller. That window needs to be smaller. So I would say 3 months for the more vulnerable group and 6 months for the younger group.
And Dr. Sameer Gupta, considering the case burden that India is witnessing on the back of taking account of the number of cases and the kind of fatal cases that we've seen in our country as well, with the healthcare infrastructure not being that up to the mark, and we've seen that over time, that the infrastructure has collapsed. Keeping in mind the larger lay of the land, how would you recommend?
Chetty, the question is that we are currently facing a vaccine shortage, and that is the reality of the situation, right? I mean, there are no two doubts about it. 2 months ago, when the vaccine initiative had started, there was a lot to go around. In fact, people were hesitant, and now with the second wave or this third wave, whatever you want to call the current wave, so we are definitely facing a vaccine shortage. And the question is, can we channelize these vaccines to people who don't have any immunity at all? And that may be a possibility, right? I mean, should we rather give the vaccine to people who have no immunity at all versus those who have some immunity from the current infection? And as the vaccine thing ramps up and we have ample supply of vaccines in the next 3 to 6 months, maybe this population, as their immunity goes down, they are now eligible for the jab that will boost the immune system. And that may not be something which may be unreasonable considering the current state of affairs.
That's right. Dr. Atul Mashru is also joining us from Mumbai. He was supposed to join us at the start of this broadcast, but due to some technical issues, he's joined us right at the end. But Dr. Mashru, very quickly, I want to get your opinion. All the doctors that we see on our screens right now are of the common consensus that waiting for 9 months to get the jab after recovering from COVID seems to be a bit of a stretch. And you offline have also told me that the gap needs to be much lower and one needs to get vaccinated much earlier after recovering from COVID. If you could explain this to us, why?
See, the natural immunity generally lasts for 3 months. After that, the immunity starts waning. And some people I have seen till 6 months also immunity is there. But after that, we have not seen much immunity. So all chances of getting reinfections are always there. So it is always safer to take vaccine within 3 months. I mean, 3 months later, one should take vaccine. Because we have seen so many reinfection and they can be serious also. So for the safety, I think we should take 3 months. 9 months is too long a period.
All right, so 9 months is too long a period is what Dr. Atul Mashru also says. And of course, this is a common consensus coming in from Dr. Vishakha, Dr. Samir Gupta, Dr. Sabarwal, Dr. Mashru, all the doctors on your screens going on to say that 9 months is a bit of a stretch, and probably between 3 to 6 months is when you can get your jab after you have recovered from the COVID infection. But then again, the questions arising on the shortage of vaccines in this country, and hence this debate continues, the suspense continues. There are different proposals that are being floated around, one big dilemma, but you heard it from the doctors right here as to why they feel that 9 months is a bit of a stretch to get that jab after recovering from COVID. With that, I thank you very much for taking the time out. This is Chaiti Narula signing off. For further news and updates, don't forget to log on to indiatoday.in or download the app.